I'm Susan White, and I am a registered dietitian nutritionist. I provide nutrition counseling for patients of Minneapolis Heart Institute, and I'm also the clinical lead for the Nolan Family Center for Cardiovascular Health at the Minneapolis Heart Institute Foundation.
I'm a cardiologist with the Minneapolis Heart Institute, Thomas Nickelbein, and my interest is preventive cardiology, kind of moving upstream, identifying it early, getting some proper treatments, and also making that kind of individual for people.
I'm Dr. Elizabeth Tui. I'm a cardiologist with Allina Health Minneapolis Heart Institute. My primary focus is in preventative cardiology. I serve as the medical director of our program. What I'm most passionate about is helping people to understand their risk of cardiovascular disease, optimally finding people ahead of time before they've had a cardiac event, because there's so much that we can do from a preventative standpoint to reduce their risk.
I feel like we do a good job, a very good job in the United States of treating disease. I don't know that we're world leaders on the front end on preventive cardiology. There's kind of two buckets here. The first one is what we've been talking about mostly, which is cardiovascular disease, blockage, kind of the same thing the guys get. That the estrogen protects you from when you're younger. That goes away at menopause and people catch up after. So women die of cardiovascular disease more than all causes of cancer combined in the United States.
It's really important to be an advocate for yourself. You know your body, to have trust your intuition, that indeed anxiety can manifest as the same exact symptoms of heart disease, but how do you know it's not high blood pressure that's making you have heart pounding? In recent years, there's been better understanding about risk factors that are unique to women. If women have menopause early, such as before the age of 40, they're at much higher risk of heart disease. If women have preeclampsia or eclampsia or gestational diabetes in pregnancy, much higher risk of heart disease. So those are signs and symptoms that can start early in a person's lifespan. To be aware of the opportunity to be more aggressive with preventative care.
Not all therapies apply to everybody. We have some tools that we use here. I helped found the Heart Scan program. What we do is we kind of give you a score, but also compare you to other people your age and sex, and then give you an idea of where you lie. It's a good starting point, but getting the scan is just the beginning. If you're going to do those tests, you should be ready to make a change based on them, right?
We know that lifestyle has a large impact on one's health. And I'm talking about how one lives their everyday life, but I'm trying to get the patient or the individual to realize that's where the power is what you do on a daily basis.
So the good news is, historically, if you look back at the heart studies, the big cardiovascular trials in the United States, small percentages of women. Now there are heart centers. You know, the foundation has a women's heart program. There's research being dedicated. There's people donating money to help study this because it's clearly different. And so actually, I think over the next 20 years, it's going to explode.
If we lower high blood pressure, even though you've had it for a long time, by doing so, we can reduce your risk of dementia, kidney disease, heart disease. So it's hardly ever too late to take the opportunity to treat heart disease and to lower the risk.
It's never too late to start in terms of good health. I think what you do today impacts your health of today, impacts your health of tomorrow, and your health for years to come. I am so blessed to have be surrounded by so many smart people. And it isn't only being bright, but it's being passionate about what they do, and that we all have the same goal in mind, is to advocate for a world without heart disease.